A very good morning to all the esteemed faculty here. I thank the AIOS for giving me this wonderful opportunity to present a case in the first day of the conference in the first session as the first speaker. Moving on to my case, I would like to present an interesting case where we can see how a single organism can present in multiple ways. Herpes simplex virus keratitis has varied presentations in the cornea. It can affect the epithelium, stroma, and endothelium as well. It is mistaken for other pathologies and hence proper treatment is usually delayed. It is the most common infectious cause of corneal blindness in developing countries. Moving on to the case, a 52-year-old woman presented with chief complaints of redness and pain in both the eyes for the past 1 week. She gave history of fall of dust in both the eyes 10 days ago. It was removed by native methods where the dust was removed with another person's tongue. Following this, redness, pain, decreased vision, and photophobia developed in both the eyes. There's no history of contact lens usage or no history of bathing in reverse ponds with contaminated water. On examination of the right eye, the vision was 6/18, IOP was 12 millimeters of mercury, cornea showed 3 mm stromal edema below the pupil, KPs on the endothelium, Hudson-Starley line, and the corneal sensation was decreased as well. Anterior chamber showed flare 2+ and cells 2+, lens showed nucleus sclerosis cataract of grade 2, fundus was normal. On examination of the left eye, vision was 6/60, IOP was 11 millimeters of mercury, and the cornea showed 10 mm dendritic corneal ulcer with terminal end bulbs staining positively with fluorescein, subepithelial haze, DM folds, Hudson-Starley line, and the sensation was decreased as well. Lens showed nucleus sclerosis cataract of grade 2, and the fundus was normal. We did syringing for both the eyes, and the ducts were free. The RBS was 82 milligrams per deciliter. Following this, a clinical diagnosis of right eye disciform endothelial keratitis and left eye dendritic epithelial keratitis was made, both probably due to herpes simplex virus. We gave, for the right eye, prednisolone acetate 1% 3 hourly eye drops, Jan cyclovir ointment 0.15% 5 times a day, and cyclopentolate eye drops BD. For the left eye, we gave Jan cyclovir ointment 0.15% 5 times a day, Moxie eye drops hourly, and cyclopentolate eye drops BD. We also gave oral NSAIDs and lubricants for both the eyes, and the patient was asked to follow up in 3 days. After 3 days, the visual acuity in right eye improved to 612 and left eye to 636. We can see that the stromal edema in the right eye is reduced and the ulcer was healing in the left eye. Patient was advised to taper the steroids in right eye and continue the same treatment in the left eye. Moving on to the literature review, as I told earlier, the HSV virus can affect the epithelium, stroma, and endothelium as well. In epithelium, it presents in the dendritic or geographic ulcers. In stroma, as in non-necrotizing or necrotizing ulcers. And in endothelium, disciform keratitis, trabeculitis, and iridocyclitis as well. The herpetic eye disease study is a multi-center prospective clinical trial. It gave various results. Out of the main are the fact that topical steroids yield faster resolution of stromal keratitis, and oral acyclovir may be beneficial in HSV iridocyclitis. The patient followed up 2 weeks later. Vision improved from 6/18 to 6/9 in the right eye, and in the left eye from 6/60 to 6/24. Stromal edema cleared completely in the right eye, and ulcer was healing well in the left eye. Clinical implications of this case is that herpes virus can have varied presentations in the cornea. It can cause vision impairment, recurrent flare-ups, and potential complications like corneal scarring. Hence, it is important that we diagnose these cases early, and antiviral treatment are crucial for managing symptoms and preventing long-term issues. Thank you.
Thank you, Soukanthi. So after 3 or 4 case presentations about keratitis, then we'll take up questions, okay?
Yes.
So now you can go back and sit there. So once the keratitis cases are over, then we'll ask you.